Hello YouTubers, welcome to my channel, Lady Nephrology, where we talk all things nephrology. Today we have a special guest, Dr. Yolanda Thompson-Martin, and we're going to be talking about a day in the life of the nephrology NP. So let me give an introduction for her. Dr. Yolanda Thompson-Martin, she is a nationally certified, has an adult nurse practitioner, and she completed her master's and her doctorate studies at the University of Missouri in Kansas City. She has practiced in the field of nephrology for more than 22 years. She has served as a sub-investigator on a number of clinical trials conducted in the Kansas City renal community. She is a published author, a member of the American Nephrology Nurses Association. She's a former National Kidney Foundation board member, current National Kidney Foundation Medical Advisory Board member, and fellow for the National Kidney Foundation. So welcome, Yolanda. How are you doing today?
I'm doing wonderful.
I'm
Thank
so happy
you.
to have you here.
I am happy to be here.
All right. So we're going to be talking about a day in the life of the nephrology NP. So I'm going to ask you a few questions, okay?
All right.
So how do you usually start your day off?
Typically, my days start on the computer. I'm responsible for rounding at 7 different dialysis centers. And so I start by looking to see the various centers that I will need to round on patients and determine which patients will need to be seen.
Okay. So and what type of patients do you usually see?
I manage the care of patients with acute kidney injury, those with chronic kidney disease, and those with end-stage renal disease.
And how would you define your role as a nephrology nurse practitioner?
My role, really by virtue of education, training, and certification, focuses on providing and coordinating the health and well-being of patients and preventing disease and the complications that could occur with that particular disease state.
All right. And do you see chronic kidney disease patients in clinic? And if so, how many do you see usually per day?
Yes, so on Mondays, I see individuals with either acute kidney injury or chronic kidney disease for half a day. And typically I will see at least 12 patients, sometimes up to about 15 over that 4-hour span.
Oh, wow.
Yeah, so pretty busy. Yeah.
Got you busy.
Oh, yeah.
And so how many days per week do you round in the actual dialysis clinics?
So I'm responsible for rounding in the dialysis centers on Monday through Friday. I manage the care of about 150 patients. So I see those patients all at least once a week. And in totality, they all will be seeing 4 visits. So upwards of about 600 visits per month, which is pretty busy.
Very busy.
Yes.
So when you rounded in the dialysis clinic, what are you focused on when you see each patient?
So I monitor so much. So the first thing that I do look at is volume status. So fluid management, determining how much fluid should be removed with their dialysis session. And sometimes if fluid should be removed at all. Monitor blood pressure, particularly looking to see if there's any hypertension. Sometimes hypotension is common as well. Many times we do have to take patients off of their blood pressure medicines when we're able to get volume off. They no longer need those medications. Anemia management, nutrition, looking at potassium, albumin, just making sure that nutrition is adequate. And then bone and mineral, which is a very complex complication of end-stage renal disease. And then, of course, access related issues. And then, of course, talking to all the patients about the importance of the modality transplant. At some point, we really would like to see all of our patients that are on dialysis transplanted if they're a candidate for that. Oh, wow. So all those pieces are managed.
Oh, my God.
Yeah.
So that is a lot.
Right, it is.
And so along with dialysis clinics, you also round in the hospital setting?
Yes.
So how does your week like when you round in the hospital setting?
So I am responsible for rounding in the hospital 1 week per month. And the hospital setting is very different than that of, say, the clinic setting and the dialysis setting, in that the patients in the hospital are acutely ill, really for various reasons. And similar to the dialysis rounding, I am responsible for looking at their fluid status, their anemia status, nutrition, electrolytes. But what's different here is really honing in on the reason why they're in the hospital and how that may have an impact on their kidney function. Many times in the hospital setting, patients are sometimes put on medications that could be toxic to their system. So I am responsible for, looking at the medications, making sure that those medications are renally dosed. Also looking at labs, and just making adjustments accordingly. And in addition, making sure that those dialysis sessions are carried out accordingly.
What about CRRT, continual renal replacement therapy?
Yes, we do a lot of CRRT in the hospital setting, particularly on those patients who are critically ill. And it has shown to be beneficial for those, for example, who are on pressors or things of that nature.
Blood pressure is not able to sustain.
Yes,
Yeah.
yes.
Wow. So this patient population, is compliance a big issue?
Yes, compliance is a big issue. When I started working in the renal setting, actually more than 22 years ago, the majority of our patients were seniors. And the change that I'm seeing now, particularly because of diabetes and hypertension, is that the demographic of our patients are much younger. And so I've also seen that access to health care has been problematic as well. And so with all those things combined, compliance has been problematic. But I can say that we are following a conceptual framework that is proven beneficial, that will help with these pieces. And what it will incorporate is the entire team to at least get this done and help in this area.
Oh, wow.
Yeah.
And so what do you do to stay abreast of the current evidence-based practices and guidelines in nephrology?
So in my role, I am responsible for doing podium presentations. I again am a member of the National Kidney Foundation, the Medical Advisory Board, Renal Roundtable Committee member, and fellow for the National Kidney Foundation. And of course, with my role as a nurse practitioner, it's of utmost importance that I stay abreast of current guidelines. And so the guidelines, at least mostly that I follow related to kidney care, is the KDIGO guidelines. Years ago, we had KDOKI guidelines. And in fact, they should be being updated here soon. But right now, KDIGO guidelines, just really to keep me abreast. And of course, we do follow JNC, just kind of whatever the basic guidelines to manage, say, hypertension, diabetes, and so forth. But yeah, I have to stay abreast of all those guidelines to care for our patients.
And how's your relationship like with the physicians you work with?
My relationship with the physicians that I work for and work with, I would describe as being great. I work with a great set of doctors, and what's even greater is that I work for a hospital that is also a teaching hospital. So I learn something from each of them every day. So hands down, they're the best.
All right. And so with collaboration, there's a lot of collaboration involved in this role as well.
Yes, it is. So on really different levels. So in terms of me collaborating with the docs that I work for and with, they're always readily available. So if I come across a issue that I may have question about, they're always available. Even when one is not covering a certain hospital, or if they're just right there with me, they're willing to provide me with, say, the answers that I need related to a health-related issue. And then in terms of the dialysis setting, we have a multidisciplinary team. And when I do round there, we have, say, the nurse practitioner, we have the RN, a social worker, a dietitian, and the whole team together, we do rounds just to make sure all the pieces related to our patients' care is addressed.
Oh, wow.
Yeah.
That's great. That's really wonderful. So what do you say is the most challenging parts of being a nephrology NP?
I would say that the most challenging portion of my job today is mostly surrounded around COVID. COVID has impacted the lives of so many. There are patients who don't have a diagnosis of kidney disease, but we know that there are multiple complications related to COVID, and the kidneys are not spared. So there's patients who don't have kidney disease, and because of COVID, they develop acute kidney injury. They develop chronic kidney disease, and they many times have progressed to end-stage renal disease. And so the leading cause of kidney disease is diabetes, and second to that is hypertension. But now what I'm starting to see is the cause of ESRD, or end-stage renal disease, today is being COVID related. And I would say that's the most challenging because it is, it's devastating to the health system.
Yes, it's just this
it
COVID
is.
It's just very devastating.
Yeah, so I would say that's the most challenging today portion of my job.
Okay, well, let's get on the more lighter side.
Yes.
What is the most rewarding part?
I would say the most rewarding part there's many pieces to that, but I would say the most rewarding part of my job is knowing that I make a difference. As you know, end-stage renal disease and patients that require hemodialysis, a life-sustaining measure, just knowing that I make a difference, knowing that I can help my patients. For example, many of the medications that our patients require to prevent, say, complications, cardiovascular complications, are very expensive. And really the out-of-pocket cost is great. And so if I'm able to get that medication for a patient and they know that it's going to help their heart function, or they know it's going to help that hyperphosphatemia or hyperparathyroidism, and they could potentially get it for free, it warms my heart when I make a difference like that. And then I'll have to add that it also makes a difference to me, or it's rewarding when I have mentored other young women and they have furthered their education, and then they've gone on to do the exact same things that I'm doing. That is rewarding to me.
She was my mentor, guys. She mentored me when I was in school.
That's rewarding to me. Yes.
And so what advice would you give any nurse practitioner wanting to come into the nephrology world?
Well, what I would tell that nurse practitioner is that managing the care of complex patients with renal disease can be quite overwhelming, because you not only have to know about kidney health, you need to know about the cardiovascular system, the pulmonary system, and how all those pieces intertwine. There's really a lot to learn, a lot to know, a lot to stay abreast of. But if you follow the guidelines, for which we know directs us toward good outcomes, then you can't go wrong.
Exactly.
Yeah.
Is there anything else you would like to add to this topic and the day of the life of the nephrology NP?
The only thing that I would like to add is that I just want to say that I am really glad that you invited me to be on your channel. I love the fact that you have a platform for which you can shed light on the problem or the issue of renal disease. It impacts really more than 33 million people. And so having a platform for which you can share information not only to patients, caregivers, family members, but also a platform for which you can share information to other nephrology nurse practitioners, I'm really thrilled about. And so I just want to say the thing that I want to add is that I'm really proud of you.
Oh, thank you. Love you.
I'm really proud of you.
Thank you so much. It's just God had placed it on my heart to really talk about nephrology and the impact that it has.
Yeah.
And so I just said, well, let me just go for it.
Yep,
So,
and I think it's great.
well, thank you.
And you'll do well.
And thank you. I'm so glad that you're here, and you did a wonderful job.
Thank you.
Thank you so much.
Thank you so much.
Please like, subscribe. Any comments, leave them below. Thank you so much. Please subscribe to Lady Nephrology. We'll see you later.
All right.
Bye-bye.